Happy Friday. Happy Friday. So, I wanted to come and talk about a subject that keeps popping up, and I think it's worth a conversation. About a month ago or so, I saw an article that a Facebook friend, Tamika, posted, and it was written by the USA Today, and the title of it was Medical Gaslighting. I read it, and it resonated with me. The reason it resonated with me is because I've had people, multiple people, mostly women, that I have consulted with, and they've been medically gaslit. The description fit what I talked about with them. Then about a week ago, there was another article in the New York Times about the same thing. I was reading a digital copy of the New York Times, and there was an article in there about medical gaslighting. So I started to really do some researching. I researched the term, and I thought it would be a good conversation for this nice Friday. So first of all, what is gaslighting? We hear the word gaslighting a lot, especially when they're talking about people with narcissistic personality disorder. That's one of the characteristics that they have. They gaslight people. The term gaslight comes from a 1938 play about a marriage based in trickery and deceit, where the husband in the play is committed to making his wife think that she's insane so he could steal from her in order for him to steal from her. So gaslit is when you manipulate someone into thinking that, or into questioning their sanity, making them think that they're insane. It could be a man or a woman. It doesn't just have to be men. Men and women play these type of games. Medical gaslight is when your symptoms are inappropriately dismissed. An example of that would be you go to the doctor, complain of back pain, and without doing any type of examination, without touching you, he automatically say, you need to lose weight, and give you a prescription for Motrin 800 and send you on your way. Well, my kidneys are back here in my flank, and it could be that. It could be a number of things. You're not going to run labs. You're not going to do anything. You're just going to give me some Motrin and send me on my way. Medical gaslighting. Another example would be you're having, let's just say, another musculoskeletal problem, knee problems. Your knees are hurting. And this is a true story. I had a person that had been to the doctor for 2 years, the same exact knee, complaining of the same exact thing. They give her medication and send her on her way. Well, we're 2 years down the line, and now they're telling her she needs to have surgery. Did it progress to that? Or was she medically gaslit, and over time, whatever was going on with her knee, it just progressed, and now it requires surgery? Medical gaslighting. So women and people of color are the greatest victims of medical gaslighting, which is what the articles say, both articles, and from my experience, what I've seen. Women are more likely to be misdiagnosed than men, though, in a variety of situations. And studies have shown that compared to men, women face longer waits to be diagnosed with diseases like cancer and heart disease. Cancer and heart disease. You're waiting. Okay. Women are also treated less aggressively for complaints of pain and often are not offered pain medication. Studies have shown that people of color often receive poor quality of care, and doctors are more likely to describe black patients as uncooperative or non-compliant, which research and my personal experience shows that it affects the quality of treatment that you receive. If someone open your clinical record and they see that you're uncooperative, they see you refuse care, and let's just say they're having a bad day, they don't feel like doing a lot of work, then they could just copy that documentation, and who's gonna know? Who's gonna know that you weren't uncooperative on this visit? You was the last time. Who's gonna know that you didn't refuse care this time? You did it the last time when you really didn't. I've literally witnessed that before. Women say that doctors frequently blame their health problems on their weight. Medical gaslighting. How many times have you been to the doctor and you tell him something is going on, and the first thing he says or she says is, you need to lose weight? I know I need to lose weight. That's not why I'm here. I'm here for stomach pains. Let's deal with that. Let's prioritize. Let's deal with that. And then we'll talk about my weight after we deal with the reason that I'm at this appointment. You don't have to say it like that. And I'm not having an attitude, but I'm just saying that's what goes through my mind. It's like, let's prioritize. I don't want to talk about my weight. Or mental health issues like anxiety, depression, or bipolar disorder. I have had friends that have went to the doctor because something is going on, and they're anxious or they're scared, and fear brings on a certain amount of anxiety, and they leave the doctor with a prescription for anti-anxiety medication, and I'm like, what did he do about XYZ, which is the problem? And they're like, well, he said it's probably just because, you know, I'm stressed out and he gave me this. And I'm like, okay, medical gaslighting. Or lack of care. They blame it on lack of care, like you're not taking care of yourself, you're not eating a healthy diet, you're not exercising, and that's why you're having these problems. Once you implement those things, then these problems will go away. Medical gaslighting. These diagnoses most definitely delay effective treatment when the situation warrant a physical examination and further assessment like labs or EKG, EKG or ultrasound. If the doctor is not even putting hands on you, if they're not even addressing the issue that you came in for, and they're telling you that it's because of your weight, then that delayed treatment. There was a patient, she was complaining of headaches, and she was having headaches for over a year, and one day she had a really, really bad headache. Over the year, they gave her medication for migraine headaches, for migraine pain, and she had a really bad headache, went to the emergency room, finally got a CAT scan, and she had a brain tumor, right? She had to have surgery. And that was really scary, because what if they would have just kept putting it off, writing it off as migraines? So it happens more often than we're willing to talk about, which is why these articles are coming up. I even looked on YouTube and I started seeing videos of women that have been medical gaslit. Most healthcare professionals want to help. We don't get into the business because, you know, we want to hurt people, harm people. At least I didn't get into it because that's what I wanted to do. I wanted to help people. I wanted to be a productive member of society, and this was just one of the ways that I could do that. But because a woman's body is so much more complicated than a man's body, all the way down to the cellular level, a woman's body is different. The cells are uniquely different. So that makes it a little bit harder to treat a woman, to find out what's going on with her. A man and a woman could have the same exact diagnosis, but different symptoms, and multiple studies have shown this. So people tend to write it off as the obvious issue. You're overweight, you're overworked, you're stressed out, you're anxious, instead of looking in deep and kind of finding what the real issue is, addressing the real issue in the beginning, to prevent delay in care, to prevent delay in treatment. So now that we know that there's a problem, now that we know that medical gaslighting exists, I never like to present you a problem without bringing a solution. What can we do to help make it better? As a patient, you should always be able to obtain, communicate, process, and understand just basic health information, right? When you experience something, so pain is always a sign that something is wrong. Pain is always a sign that something is wrong. Even if it's something simple, it's a sign that something is going on in your body. So what you need to do is you write down where the pain is, the location of the pain, when did it start, what makes it better, what makes it worse. Make you a doctor's appointment. Write down your top 3 concerns. Write down all your medications, including vitamins and the supplements. Write down any life challenges that you've had since your last appointment. And then you should always have a support system. I tell my mom, when you go to the doctor, if you don't feel comfortable, you need to tell him, hold on, let me call my daughter. Or have me on the phone. She doesn't like to have me on the phone because she doesn't want to make the doctor or the MP feel uncomfortable. She's very respectful. She wants to respect them. But if it's something that she doesn't understand, then I'm going back. I want to know what did you say to my mom, because we're going to address issues as they come up. We're not going to medical gaslight my mom. And then never refuse care. Never have an attitude with the person that's responsible for your medical care. They have access to your clinical record. They have access to your chart. They can write anything. And every person of the healthcare team that comes along and read those notes, they could treat you based on that, based on what's written. So if it's written that you're non-compliant, you're uncooperative, you have an attitude, and you have an attitude right now, 9 times out of 10, they're not going to give you good treatment. So never refuse care, never have an attitude. Always say stuff like, I prefer a second opinion, or my family member is a medical professional, I want to talk to them first. Things of that sort, to not make them, and you could even reiterate, I'm not refusing care, I just want to have a second opinion because I don't feel comfortable right now. You could say those things. It's perfectly okay. Just don't have an attitude. Don't have an attitude. Don't be mean, and don't refuse care. Last but not least, follow up, follow up, follow up. Listen, if they give you labs, go get your labs drawn. If they give you, you don't know how many, I could tell you so many homes that I've been in, and they can't even find the fecal occult blood test. That's to check for microscopic blood in your stool to see if you could possibly have colon cancer. If they give you that test, do it and send it back. If they send you to get labs, go get your labs. If they send you to get an x-ray, go get the x-ray. Don't sit on that. If they send you to if they give you a referral to a specialist, follow up, make the appointment. If they give you a follow-up appointment because they want to monitor your condition for 2 weeks, go back to the doctor in 2 weeks. Don't just let it go. This is your life. This is your body, and it's your responsibility to take care of your own health. I hope this helps. Medical gaslighting is a thing, right? And people are losing their lives. People are suffering as a result of it. I hope the video wasn't too long, but I had to get it out there. I want you to have a beautiful, beautiful Friday, a great weekend. Tomorrow's my dad's birthday. Happy birthday, Papa. Talk to you soon. Bye.